Thank you for your interest in UC San Diego and our Geriatrics Fellowship Program. I am Allison Moore, and I am proud to serve as the Chief of our Division of Geriatrics and Gerontology. Thanks to our team, our program is now ranked 13th in the nation according to US News and World Report. It is an exciting time to be here at UC San Diego. We have multiple programs focused on educating trainees on the needs of older adults, and with San Diego State University, we co-lead a geriatrics workforce education program grant. We were the first healthcare system in San Diego to join the National Age-Friendly Health System Initiative, and we have a brand new geriatrics quality improvement medical director to move the age-friendly health system agenda forward. We have programs like the Alzheimer's Disease Resource Center for Minority Aging Research and a gerontology research collaborative that brings aging investigators from UC San Diego and other regional institutions together to discover and innovate. If you wish to pursue additional training in research or quality improvement after your geriatrics fellowship, we have a variety of training programs to do that. And we have a new School of Public Health and Human Longevity Science, and are home to many other programs for which aging is central. So, in closing, I just want to share with you that I love many things about our group, including our passionate clinicians, educators, and researchers, our diversity of people, programs, and interests, and the collegiality and kindness with which we operate. So take care, and I hope to meet you.
I picked UCSD for my geriatrics fellowship because of the people. I know that there's a lot of really amazing programs out there, and honestly, you can get great clinical geriatrics training anywhere. But I really wanted something special and something extra in my geriatrics fellowship year, and I definitely found that here at UCSD. The entire department honestly has become like my work family. I feel so comfortable around them, and I've really developed friendships and mentorships that will last me not only my entire career, but also my entire lifetime. And for me, that helped me become a better clinician and a better person. And even now that I've graduated from fellowship and I'm working in my own job, I'm still calling and texting a lot of the faculty members there because I want their advice and I really value their opinion. And I honestly cannot imagine doing my fellowship anywhere else.
When I was choosing fellowship, I was looking for a program with diverse experience and opportunities. At UC San Diego, you'll be able to rotate at many different sites in many different specialties in geriatrics. This includes acute trauma service, a VA, CLC, home-bound physician rotations, skilled nursing facilities, outpatient geriatrics. So there's a lot of opportunities to learn at UC San Diego.
The fellowship here is very open and loving and honest and sincere and really here for you to learn. What I really love about this particular fellowship is it's your fellowship. You are going to take of it what you will. It's going to be molded toward what you're interested in. The faculty and staff really want to make sure that you are becoming the geriatrician that you want to be, not the geriatrician that other people want you to be. So that's a fabulous part of the culture here.
Our clinical training spans the care continuum for older adults, including inpatient, outpatient, subacute, long-term care, and home care. UC San Diego's downtown site in Hillcrest has more of an urban feel. This is where fellows provide geriatric consultation on the inpatient trauma service. This is also where fellows co-manage patients on our renowned senior behavioral health unit. UCSD in La Jolla is home to our senior emergency care unit, which was the first accredited in California. This is also where we have many of our specialty clinics, including the Medicine for Seniors Clinic, where fellows will take care of some of the most complex older adults in primary care. The VA is our counterpart to core training in our fellowship, where fellows will spend time at the CLC, or the Community Living Center, the Home-Based Primary Care Program, and the Geriatrics Primary Care Program there. We have also developed community partnerships with a local hospice agency, a PACE program, as well as a memory care unit to ensure that our fellows receive comprehensive clinical training.
but I was ultimately drawn back to UCSD and the VA because they really are wonderful places to work and learn. Having worked in the community setting, I have a deeper appreciation of what it is that the VA in particular is able to provide. It is a mission-driven organization who is tasked with caring for those who served, many of whom bear both physical and psychological wounds from their time of service. And being united by that common mission makes it a very collaborative and team-based environment, which I love. That is geriatric medicine at its core, team-based care. I also love that we're able to provide true wraparound services to seniors who in many settings would have very limited options available to them.
I definitely think that UCSD Geriatrics prepared me for my future. Obviously, I just graduated, so I haven't been out of the fellowship for that long, but I am in a palliative medicine fellowship at a different institution, and I think that the fellowship at UCSD gave me such a great foundation for communication skills as I start this new fellowship, and I feel confident answering any geriatric questions that some of my colleagues may ask of me this year.
I think the fellowship prepares you really, really well for real life and your first job. I've been working my job for the past couple of months now, and I feel so comfortable in my role. I think the fellowship does a phenomenal job really guiding you to make your own clinical decisions and feel confident in those clinical decisions. And honestly, I, for the first time, feel like, hey, I am the geriatrics expert here. I do know what I'm doing, and I have the tools, and I've been trained incredibly well to do this job. And it's actually kind of a nice feeling.
I think what makes us unique is our culture. Our faculty are incredibly dedicated to fellows education, and they're such an inspiring group of geriatricians in and of themselves, many of whom hold leadership positions both locally and nationally. Not only do we strive to train exceptionally skilled geriatricians and leaders in the field of aging, but we relish the growth alongside the fellows as we face challenges and triumphs during the course of the fellowship year. We try to keep our didactic series active, dynamic, and hands-on with field trips and workshops such as wound care training. I feel lots of gratitude for being the program director and often feel like I am learning just as much from our bright and motivated fellows as I am able to teach them.
My favorite thing about the fellowship was definitely my co-fellows. I loved the relationships and friendships that I made with them, and I think what's so unique is that not only are there a couple of geriatric medicine fellows, but there's also a couple of geriatric psychiatry fellows that you get to work so closely with. And that has been absolutely invaluable to have those relationships, because now that I'm practicing without geriatric psychiatry where I am, I can text them and say, hey, I have a question about this. How would you do this? Or how would you do that? And it's really made a big difference. And I think that's honestly, I wouldn't trade that for the world.
I think my favorite aspect of the program here is that everyone is just so nice. Doesn't hurt that we live in beautiful San Diego and you can just enjoy the weather when you get a time off. It's simply incredible here, and I just love everything about it here. I can't really pin down one favorite thing.